Good afternoon. My name is Francois Baird. I'm one of the founders of the FairPlay movement, and it's perhaps a very good opportunity not only to introduce the panel, but to remind everyone again what FairPlay is. FairPlay is an independent movement. We started it in 2016, and we started it after getting very concerned about job losses in rural areas where poultry operations were closing down as a result of chicken dumping. We didn't fully understand the scope of the issue then, but since then we've learned a lot, and we've learned a lot mainly due to experts we spoke to. One of our policies is that we always try to find a higher order solution. We try and bring people together, even if they disagree about everything else. If they agree on a single point, we try and focus on that single point of agreement. This is why it was very touching for us when the trade union members and the management of poultry companies marched together to the EU embassy right in the beginning of our campaigns to say, we don't need dumping. We need to grow the industry in South Africa. And I think that's something that FairPlay has focused on. We're also very concerned about small farmers, and we're very concerned about the health of the nation, because FairPlay's position is that we stand on the side of the people. We don't speak for other people, we only speak for ourselves, but we try and bring the concerns of those who are not always in a position to bring their own points of view across. It is also a pleasure for us to know that we have a close working relationship with the industry. Even though we are a separate organization, and sometimes they headbutt us from time to time to say, why are you doing this? The answer is that we think for ourselves. We don't always agree with everyone, including government, but we always seek points of agreement, and we always seek a higher order solution. So if I lead in today, the purpose of today is lessons learned from the avian influenza outbreak that we've experienced. We're not only hoping to look in the mirror. In fact, we want to use the lessons learned to make sure that we do better in future, that we protect both South Africa's favorite meat, protein, but that we also look after all the jobs in this industry. We saw the most recent jobs number, and it's the worst, I think, ever. And when you have 33% nearly of everyone in South Africa unemployed who want to work, that is a real concern. And it's a real concern because poultry operations are mostly focused in rural areas. And that's where jobs are even harder to come by. So for us, it's a great honor that we have today. I jokingly call this event the 3 veterinarians and a chicken farmer. We have on the line Dr. Kalaki. Dr. Kalaki is the Director of Epidemiology at the Gauteng Department of Agriculture and Rural Development. He is a vet. He's one of the 3 vets. We have Dr. Majakweni Kwalela, Deputy Director of Epidemiology, Biosecurity and Laboratory Services. She also holds a degree in veterinary science. And then we have Dr. Grobler, AMM Grobler, and Dr. Grobler is the Deputy Director for Animal Health Regulatory Services in Gauteng. Between them, they have long government service, for which we thank them. It's tough sometimes to be in your position, but they also have huge experience as a result, and we hope to benefit from that today. It's also an honor to have Izaak Breitenbach with us. Izaak is the chicken farmer. He's the general manager of the broiler organization of the South African Poultry Association, and has been a leading voice on the issues facing the industry. FairPlay can never talk on behalf of the industry. We can't ever talk on behalf of government, but we're very grateful that the industry has been so responsive, not only to concerns raised by FairPlay and others, but particularly by fighting to ensure that there's no shortage of chicken as a result of the avian influenza outbreak. So in kicking off, I'm going to ask our panelists, starting with Dr. Tshwane to just give us a bit of a flavor, tell us a little bit about yourself, and then we'll kick off with the formal first question. Dr. Tshwane?
Where do I begin? Thank you so much, Francois, for that warm welcome and for having us here. As introduced, I work for Gauteng Agricultural Department and Rural Development, as well as Environment. I am the Deputy Director of Epidemiology. And I've worked with SAPA, I've worked with various organizations, and I'm looking forward to the chat that we'll be having today, and hopefully we will be able to come up with recommendations on how to better manage and control avian influenza. Thank you.
Thank you very much. Dr. Grobler?
Thank you, Mr. Beard, for the warm welcome. I'm Audrey Grobler. I'm the Deputy Director for Animal Health Regulatory Services. So together with my regulatory veterinarians and my team of animal health technicians, we are the people on the ground, physically working and fighting all disease outbreaks. So it's going to be an interesting discussion this afternoon, and I'm looking forward to it.
Thank you. Thank you very much. Well, let's then turn to Dr. Kalaki. You are on mute, Dr. Kalaki.
Yes, apologies for that. Good afternoon, everyone. My name is Alan Kalake. I'm a veterinarian by training. I'm the Director for Veterinary Epidemiology, Biosecurity, Diagnostics, Quality Assurance, and Law Enforcement in Gauteng Veterinary Services. We really appreciate the opportunity to share our experiences with all the participants in this church. Yes, indeed. As you all know, Gauteng was the epicenter of this outbreak. When it started, we thought, look, we have had 2 previous outbreaks. It should be a walk in the park. But lo and behold, it's now May 2024. We haven't closed all the 80 outbreaks that we have recorded in our records. So indeed, having experienced this massive outbreak, there are things that we learned along the way that perhaps we could share, with the view that maybe they would better prepare all of us who are stakeholders in the success of the poultry industry and in the success of South Africa going forward, because you could argue that this won't be the last outbreak, over and above being a vet, so that I don't undersell myself. Okay, I'm a trained veterinary epidemiologist from a very renowned institution in California called UC Davis. And I think I have valid claim to consider myself a professional futurist, because Stellenbosch has conferred on me the degree for having completed my MPhil in future studies. So hopefully I'll be able to add some value in the discussions today. Suffice to say, we would have expected colleagues from DALRA, Animal Health DALRA, to be in the meeting as well, but I think you are aware there is an outbreak of foot and mouth way down in the Eastern Cape, which is now keeping them busy, because up to now, we thought the Eastern Cape and the Capes would remain free of foot and mouth disease, but lo and behold, here we are. The system has to respond so that that outbreak gets stamped out as soon as possible. So thank you very much. We hope to enjoy this discussion. Thank you.
Dr. Kalaki, thank you very much. It's great to have someone with a newly won crystal ball with us. So we're going to rely on you to tell us what's happening in the future. I particularly would like to know the rugby scores in July against the All Blacks and the Aussies. Dr. Breitenbach, Mr. Breitenbach, Mr. Izaak, please introduce yourself, and then we'll kick off.
Francois, thank you. I'm Izaak Breitenbach. I'm the General Manager of the Broiler Organization of SAPA. I'm also chairing the highly pathogenic avian influenza work group in industry that interact with Delvat. It's a pity we don't see Delvat people yet today. We've certainly had various productive interactions with them in the last 6 months. I'm looking forward to the rest of the webinar.
What a stellar panel we have. I'm really pleased that all of you agreed to participate. And without much further ado, I want to kick off by asking each of you in turn, and I'll start with Dr. Kalaki this time, each of you in turn to give us your perspective of why was it so bad this time around, and what do you think is the harm that's been done as a result of this really big outbreak. Dr. Kalaki, can we start with you?
Thank you, Francois. Yes, as we said earlier, this was a massive outbreak. Should I put on my camera? I'm not sure. This was a massive outbreak compared to the previous 2 other outbreaks. And yes, Gauteng was the epicenter. The question of what do you think happened is a very valid question, okay? Because if one looks at the experiences of the 2 previous outbreaks, I think in those outbreaks, we did not encounter some of the difficulties we encountered in trying to stamp out this outbreak as soon as possible. As you can imagine, when there is an incursion of a new pathogen into an environment in which the pathogen was not there before, logic dictates that you don't want to live with the pathogen, and therefore the best approach is to trigger your outbreak emergency response and smother it out and remove it from the environment, which we did with the previous 2 outbreaks. That was premised on, I think, the readiness of the state, and I think we were ready for this 3rd outbreak, and as well the cooperation from all the producers who would have unfortunately been affected by the outbreaks and incursion of the virus into their farms. Look, our experience, if we have to cut to the chase over this 3rd outbreak, is that we did not get as much cooperation as the previous outbreak required, and we could debate as to why some elements of the poultry industry decided against cooperating with the state to stamp out the virus, especially given that this was also now a novel virus. The previous outbreaks were H5s. This one was an H7. And therefore, there were valid reasons to say, do we want to live with H7 viruses in South Africa? Probably no, and therefore, we should stamp it out. How do we stamp it out? The state comes and regulates the disease control measures as stipulated in the Animal Diseases Act, and then the expectation is that the affected farms, members of SAPA or not members of SAPA, would allow the state to do its job. Why is that so? It's because obviously in an outbreak, not everybody gets affected, and the state has to respond, this being a list A control disease, has to respond to protect not only those who are affected, but the interests of those who, for that time being, were free of the disease. So yes, as to what happened, I think the cooperation from all the affected farmers would have been better. We would have been able, I think, just like the previous 2 outbreaks, to stamp it out. But unfortunately, where we sit now, there are still 19 open outbreaks, I think. And of those 19, I think the 10 remaining are those that have said, no, we will apply for exemption for DALRAT from the prescribed regulated measures for AI. And then the other 10, I think, have allowed us to cull and are busy with the cleaning and disinfection and the 1-month post-cleaning and disinfection period so that we can then close them as well as outbreaks. So we'll be left with the now and that are waiting the exemption application decision from National. Thank you.
Thank you. I have many follow-up questions, but we'll get to those. Let me first ask Dr. Tshwane, what is your perspective on the effect of this and why it happened? I think you're on mute.
Thank you so much, Francois, for the opportunity. I guess I'm adding on to what Dr. Galage has already put in place. I think anecdotally, what we saw with this particular incursion was that the virulence was not as high as what we typically see with the H5s and the sort of mortalities that we got. And
what does that mean if the virulence is not as high? Just because I know you know what you're saying, but
okay, if you were to put 100 chickens with some of these viruses within a day, all 100 chickens, or at least 99% of those chickens, would be either very sick or dead. With ones that are less virulent, you may find that perhaps about 30%. I think those were the rates that we sort of got with this particular strain. And I think because of that, we, and when I say we, I mean collectively between ourselves, industry, just in approaching the control. I think there tended to be different ideas in terms of control, because usually we stamp out. It's infected, we stamp out, and usually people also do not want to take chances. And within that farm, they will stamp out or cull all of the birds within that farm, the farm that's under quarantine. In this case, we saw quite a bit of implementation also of novel ideas, where there were exemptions that were requested, and as a result, we found that we tended to keep birds that would have been exposed to the virus for much longer, within the space. And obviously that then has its own risks, because the longer you keep it in your space, it will tend to fester, for lack of a better word. So for me, I think those were some of the challenges that we had. And also, because of the lower virulence, the cornerstone or the key issue when it comes to control of avian influenza is good biosecurity. If you implement good biosecurity measures consistently, you have won half the battle in terms of reducing the risk.
What does that mean? I mean,
what it means.
It's an impressive term. I just don't know what it comprises.
Okay, biosecurity is I will say it's a series of measures that one implements in order to reduce the risk of introduction of a disease into a particular environment. So that would entail different things depending on how the disease is transmitted. In the case of avian influenza, when it comes to personnel, for instance, you'll find that we don't allow people to bring the clothes that they had. We call them street clothes. The clothes that they had, walking about outside, for them to bring those into the chicken houses. The change of boots and so on, and various other measures. Essentially, just trying to control the possibility of transmitting the disease from the outside world into the chicken house. So that is the cornerstone when it comes to avian influenza. And unfortunately, we do find that from time to time, the implementation of those biosecurities tends to become, people become lax with the implementation of those. And also, I think because it's a lower virulent disease. Now, this is a personal observation, and it may not have happened like that. But what I tended to see was that because it was less virulent, we tended to take a bit more chances, you know, within the industry, and would find that there were movements of birds, there were movements of feed trucks and so on, which also tend to be a factor in how the disease is disseminated within the industry. So those were just some of my personal observations when it came to this particular outbreak. Thank you.
Fascinating. Well, Dr. Grobler, you move on the ground with your team. Give us the ground level view. Why did this happen, and what was the effect?
Yes, thank you for the opportunity. I think one of the important things was, without repeating what previous my colleagues have said, because this was so, you know, it's classified as a low pathogenic avian influenza. It's classified as a high pathogenic avian influenza, but it was not as pathogenic as the previous strains we've dealt with.
Yeah.
So
is that the same as virulence? Is that, do you mean?
Yeah, virulence, it doesn't kill as quickly. Yeah, and it does not spread as quickly as the H5 outbreaks we've dealt with in our previous years. So I think because it spreads so slowly within a specific house or farm, and also there were lower deaths, it happened that diagnostics were done a bit slower than with cases where you had instant high deaths of a lot of birds. So that was one of the things that actually caused that we as government officials were running behind the outbreaks the whole time, and we did not get the chance to, you know, predict where it's going to go next. The other factor is also because there was a long period between the start of the infection on a farm and diagnosis. There were also the movement of feed trucks and, you know, people on and off the farms, which also assisted the spread of the disease to more properties. And I think also something else that might have contributed to this magnitude of the outbreak definitely was that we sat with a population of naive birds, and the layer industry was the hardest hit, and there's a lot of scientific explanation behind that. You know, there's a certain place in the, not that I'm a researcher or a scientist, but there's a specific area in the oviducts where this virus actually attached to, if we can put it in layman's terms, and that is why the poultry industry was hardest hit, which was the layer industry. It's very unfortunate. Yeah, and I think...
Sorry, just to check the terms. So by layer industry, you mean where we get our eggs from?
The eggs and our parent stock for the broiler industry, and parent stock for the layer industry, and then also the layers for where we get our eggs from. Yes, in a nutshell.
Thank you. Izaak, give us the industry perspective. Why did this happen, and what was the effect?
Francois, we've learned a lot of lessons with this particular outbreak. We had an outbreak in 2017. We culled about 1.5 million birds. We had a second outbreak in 2021 where we culled about 3.5 million birds. And then we had this disastrous outbreak in 2023. I think we mustn't forget that in 2023, we actually had two viruses. The H5 virus, there was an incident in the Western Cape where we culled the birds, and that particular outbreak was well controlled. There was a second outbreak in KwaZulu-Natal, again H5, and the culling policy worked well. We contained the disease, and the disease was eradicated. The H7, what we've learned from the H7 virus is that it was completely different in its behavior compared to the H5. We really struggled with incredible biosecurity, and we've got so many examples of that to contain the spread of that particular virus. So we believe that this virus spread a lot quicker than the H5 virus. Having said that, there were survivors. That is one of the other lessons we learned, that there were survivors from the H7 birds that some companies kept alive. That was not a policy of SAPA. SAPA put out various communication to producers to state that we follow the Animal Diseases Act, we follow the culling policy, because that is currently the policy. After the 2023 outbreak, in which we culled in the excess of 9.5 million birds, that caused incredible hardship. It caused financial hardship, not only for chicken producers, but it actually went further into the economy. We also find that having this amount of virus around in the country is not safe for humans. We would rather reduce that virus load. To cull 9.5 million birds, put them in the ground, also has environmental impacts. So we decided that a different strategy is necessary, and we do need, after the disastrous outcome of 2023, to actually address that this disease doesn't happen again. And we've then decided, together with Delrad, that the appropriate action would be vaccination. And in most of the countries in the world, or all the countries in the world, we do not find the H7 strain of bird flu that we find in South Africa. And therefore, it is probably not as necessary to vaccinate in those countries as it is in South Africa. But nevertheless, we made a decision to follow the route of vaccination, controlled vaccination. It is not blanket vaccination where anyone that can afford the vaccine can buy the vaccine and vaccinate. But these companies or farms will need to comply with biosecurity rules to contain the disease should it happen. And secondly, with monitoring procedures that we need to have in place to see if we have a vaccinated flock that contained the disease. Now, we are very positive about the future in terms of vaccination. I just returned from the International Poultry Council, where I discussed this with one of the veterinarians that's involved with the vaccination of ducks in France. And that actually worked really well. Although the total incidence of avian influenza globally or in Europe has reduced, they've seen a marked reduction in the infection in chickens and ducks in France. And in only one case did they pick up through their monitoring, as we propose, that a flock contracted the disease, and that flock was obviously stamped out. So we've learned a lot of lessons from this previous year.
This is a fascinating discussion, because I think if having listened to all the participants, a number of things jumped out for me. The first is the C word, culling. And we at FairPlay have been advocating for chicken farmers to be recompensed for culling their chickens. We are told there is a policy that allows for compensation. Dr. Kalaki, can you tell us how much a compensation was paid out for culling chickens?
Indeed, as far as I'm aware, for this outbreak, for those who have applied, the law allows for farmers who have been affected by state-regulated disease control actions to apply to the National Director for consideration for compensation. It's not in policy to say you will get card and then be compensated. It's, as far as I understand, it's not like that. You then apply so that the National Director for Animal Health can consider your applications and see whether or not there is merit in what you are proposing and requesting from government, okay? Because the very same act that we are using places the onus on the owner of the animal and or the manager to take extraordinary measures to prevent their animals from being infected. You'll probably agree with me. The environment around which we are currently experiencing as a country, there is no money. The economy has been growing at less than 1% for quite a number of years now. The impacts of those is that fiscally as a country, there is no money going around through which, given the many competing needs that government faces, to favorably consider a request for compensation. So for this outbreak, I'm not aware if anybody of those that tried to apply, I'm not aware if anybody has been compensated for the culling exercise if they allowed it. Because of course, the culling exercise is not a decision of the state. The owner of the animal decides, given the feedback I'm getting from the state in this environment, in the law that is applicable in the environment, the best decision going forward is to cull. And then the owner of the animal decides to cull the animals. I think sometimes they give an impression is given that the state is culling, whereas the owner of the animal agrees for the animals to be culled in pursuit of stamping out and therefore bringing an outbreak to an end. I thought perhaps we need to put that through, because I think sometimes this is the misunderstanding of what is meant by certain clauses in the regulations and in the legislation, that we then hit heads against each other and there are delays and so on and so forth. And as a result, the disease spreads further and further. I'm not sure if we are going to go back to what do you think happened. You will have heard that.
Please add whatever you'd like to add.
Because the virus, this virus in particular, was a less virulent virus, I suppose human nature would say, no, why don't we take our chances? I think one of the difficulties, personal opinion, one of the difficulties was the hypothesis that then came through, which could have led to complacency on the part of the producers, because at some point, discussions that were coming out was to say, no, this virus now is being spread by the wind. And I think we spent quite a bit of time debating this wind hypothesis, whether or not it was causing the spread. And there were positions that were saying, but you guys, come on. This virus and AI viruses, as far as we are aware, are spread by movements of people and trucks and fees and so on and so on, over and above the base, of course, the wild base. But when we eventually got to that point where they say, no, it's not the wind, it could be other ways in which this virus is spread. We were now close to the 80 outbreaks that we have experienced in the course of the past year. I think, yeah, this virus, if it taught us anything, is that, look, it's nice to debate and discuss, but if the debate and discussions are not leading to quick stamping out, we are playing with fire.
Well,
if the next outbreak early, there will be even massive outbreaks in the future. Thank you.
Thank you. I think you touched on a very important point, and that is that the government decided this was not important enough for allocating finances. It's true that finances are not infinite. All of us know that, because in this high inflationary environment, it's very difficult to make ends meet. But Dr. Motshekwane, don't you think that culling would perhaps have been facilitated faster if, with confidence, producers, especially I think small-scale farmers, who don't have many options when it comes to allocating money, because they don't have money. They live from hand to mouth, literally. Don't you think a compensation policy like the rest of the world, would have been a good idea or facilitated more action?
Thank you very much, Francois. Francois, you know, I tend to have a different take on the management of the risk of disease.
Give us your
because I do feel that it's a shared responsibility. And it's probably one of the areas that I would really like to see with our recommendations, that the state, together with industry, and in fact all, you know, across all different types of poultry farmers, that we have an open discussion that looks at the reality of South Africa as a country, and it also looks at the options that may be available to us, because I do believe we probably need to look at some form of risk insurance that we could put, you know, some pot or some kitty that we could put in place that would tend to assist us in these instances, because I think that would end, you know, the endless debate of am I going to get compensated? Is this and we just take that responsibility and we look at that, and whichever model we use in terms then of compensating farmers that have, you know, that have experienced the disease or that have been affected, we then compensate from that particular fund. I think that would assist, because I think it would give assurance to the industry, because it is an important industry. It's an important employer. Food security risks are managed, so it is an important industry, and I think government also realizes it is an important industry. But I do think the realities of our country probably need us to think outside of the box when it comes to compensating for such diseases. Thank you.
This is why these conversations are so important, because I think new thinking is required. Instead of hiding behind a rule-bound approach and allocating blame, instead of taking some new thinking forward. Because quite frankly, if you're a poultry farmer in South Africa, you are part of the biggest agriculture sector. And surely that is strategic. And Dr. Motshekweni, that's a really interesting idea. I think I'd like to suggest that maybe in future we ask Treasury and a few of the financial mavens in Johannesburg to get together and discuss whether this can happen. Dr. Grobler, on the ground, do you think the culling issue wasn't getting through, or do you think it's really because of all the hardship that the country is going through that there's also a real uncertainty amongst poultry farmers and layer farmers to cull chickens and not try and save some of them?
Thank you for the opportunity. On the ground, and I'm speaking now as a veterinarian who's working on the ground, even though I'm a pen pusher lately. According to the Animal Health Diseases Act and the regulation number 2, the table 2, all birds infected with avian influenza and in contact with avian influenza has to be culled. So our quarantine notice all instructed the culling of the birds. If you consider that out of 80 outbreaks, we only have 10 farms who opted to make use of their right, which is also described in the Animal Health Diseases Act, that they can make an objection to the national director if they are not happy with our quarantine notice. We only had 10 farms which made use of that right to opt not to cull. So I think 10 out of 80 is not a bad strike rate for us, you know, culling the infected and in contact birds. And all the farmers were very cooperative. And we are very humbled and thankful for that, because this, once again, just made me realize how important it is to have a good relationship with a farmer, a good relationship with the industry and our consulting veterinarians. We interact with them on a daily basis in the field. So I don't think we missed the ball that much with the culling. And talking of our small-scale farmers, this outbreak, I quickly counted on my line list. There were only 2 small-scale farmers 12, sorry for the mistake, 12 small-scale farmers involved. And we personally, as animal health regulatory, we were all on all those farms, assisting with the culling, assisting with disposal, assisting, made use of our own resources, assisted with cleaning, disinfection, and the quarantines on all of these informal farmers or small-scale farmers have been lifted already. And there are means that we can assist these farmers, maybe in the future through our agricultural section, but I have put that on the back burner in the meantime until we are sure that this outbreak is under control. So, yeah, I think it was not too a bad attempt.
Thank you. Izaak, from the perspective of the industry, what is your view on culling? And is South Africa the only country that doesn't recompense?
Francois, yes. If we talk about the Animal Diseases Act, the Animal Diseases Act intends to solve the problem of prevent producers not to cull their chickens. In other words, they must cull. And one of the big constraints that the producer will have is that actually he culls away his complete livelihood. And if we talk about Maslow's theory, we can easily say that if we look at that, Maslow says that we will look at self-preservation first. That is a key consideration for each and every one of us. So fundamentally, the fact that not even an export farm with incredibly high levels of biosecurity could comply in the last 3 years to be compensated tells us that the intent is not there to compensate. But then one must not complain about what the producers have done in not culling the birds. We don't propose that. We don't support that. But they have preserved themselves in circumstances where they weren't reimbursed for birds culled. And clearly, the Department of Agriculture expect, in terms of the Animal Diseases Act, for producers to cull their birds. And that's what we would like to do. We must also just mention here that in terms of broiler breeders, not one single flock was not culled. They were all culled. And yet the disease still spread. There were some of the layer flocks that do not farm the birds on litter. They survived the process. But we strongly believe that compensation would have prevented what we are currently seeing.
Thank you, Izaak. I just had to cough a little bit, and I was very worried about being cold for having influenza. So forgive me for going off camera, going quiet. You make a very important point, and that is self-preservation. As a country, of course, the preservation of the poultry industry is vital for the nation's health, for jobs, for all the important reasons we've already had. There's a question here on the chat line. Will South Africa ever create smaller quarantine compartments? Is this something that can be done before the next major outbreak hits? Having provincial-sized compartments seems arbitrary and puts producers and small farmers at a huge disadvantage, especially compared to competitors in the US, EU, and Brazil. I think this leads us to the next phase of our conversation. What must be done? So could you start with that question? And if you don't mind, just give me an indication who you think should start with the answer. I don't know if it's you, Dr. Kalaki, or Dr. Majukweni, or Dr. Grobler. And let me repeat the question. Will South Africa ever create smaller quarantine compartments? Is this something that can be done before the next major outbreak hits? Having provincial-sized compartments seems arbitrary and puts producers and small farmers at a huge disadvantage, especially compared to competitors in the US, EU, and Brazil. Dr. Majukweni, I see you on camera, so I'm going to assume that you would like to participate in the conversation about that point.
Yes, but before I do that, if you will allow me, Francois, there's one aspect that Mr. Breitenbach spoke to when it comes to vaccination of ducks and reduction of the risk within France. We must also understand that in different areas of the world, the epidemiology of the disease is different. France has got a very big foie gras industry. So they actually farm in ducks. And as a result, it will definitely vaccinating ducks in that particular instance makes sense. So those are some of the things that we probably need to look at as a country when we have the discussions around vaccination. And then when it comes to your question around compartments, I don't know if I understood it properly, but there are two things that govern that I will say that govern the system of compartments within our country. The one is that your compartment is not necessarily provincial. You as an individual farmer can have a compartment as long as you stick to the requirements of the VPN that regulates what sort of biosecurity measures one needs to have in a compartment. So one farm can be is actually looked at as a compartment. However, within that system, when you want to now export and do other things, and you want to be registered as a compartment that is able to do that, we also need to look at the downstream. Where do your birds come from, and so on? Is the biosecurity where your birds come from? Is it at the same level? So that is the system of compartments, and that is how compartments work. So essentially, when somebody at the end of the day is certifying that indeed this particular product is a product coming from a compartment, they themselves, are happy with the assurance that they are providing to the trade partner. Then there is an aspect of certificates that our trade partners require, and those are based on import requirements from those countries. Now, those import requirements, we can negotiate them. However, they are
What is this?
What is included in there is based on the perception of risk from your trade partner. So that we can negotiate, but we don't have a lot of control over what the trade partner requires. So the trade partner may require that you come from an area, we can say a 200-kilometer radius. Of course, that is still supposed to be within the ambit of what is recommended by what was called the OIE or HOA. So those are the principles that come into play. So in easy terms, a compartment can be just the one farm. So we have that system in South Africa. I
Thank you
hope
for clearing.
I haven't confused and have clarified the matter.
Thank you for clearing that up. There are a couple of terms that I don't understand, but we won't go into that because we don't have time. I want to lead on to the next question on the chat line. There's a comment first, which is something dear to FairPlay's heart, and that is a comment from an anonymous attendee who says, "We have rebates for importers, but farmers are not compensated for culling. Ouch." So this is something that maybe could play a role. Perhaps the funds coming from the anti-dumping duties could be allocated to preparing for the next pandemic. A question from Karin Creer. Could you please elaborate on the vaccination protocol proposed by the state and why it is unpractical for the industry? And given the last part, Izaak, I'm going to ask you to start the response, and then from our other panel members, whoever wants to participate can just come up again.
Thank you, Francois. I think I can give an elaborate answer, but let me try and put it as succinct as I can. One of the problems that we have is that there's not enough state vets available to, for example, deal with the applications for vaccination. So there's a request to industry for veterinarians to be seconded to do that work. A second problem is one of state veterinarians to attend to the collection of samples. Now that can't be done because there's not enough of veterinarians available. In that particular case, it is asked that the private veterinarian do the sample collection. But the private veterinarian, we only have one or two per company. In his personal capacity, will have to go from farm to collect samples, which is a huge risk for biosecurity spread. And we can't get agreement that normal farm staff that take all the other samples, even the samples that we take for export farms, to do that particular work. I'm just going to mention one other one, and that is that if we look at the monitoring protocols that is being proposed, is so expensive that it's prohibitive for a farmer to be able to do that. So those would just be three of the, there are a couple more, but those would be three of the constraints that we're struggling with.
Thank you, Izaak. That's quite an insight in terms of the practical application of vaccination. There's a question here on the chat line that says, aren't local producers, poultry producers, mandated to vaccinate against Newcastle? Why is an H5H7 vaccine different? Dr. Grobler, could you perhaps latch on to what Izaak has raised as some of the issues that need to be solved, and particularly on the veterinarians, as well as why is H5H7 vaccine different from Newcastle vaccination?
Thank you. This is a difficult question, which we are not the policymakers as a province. So I think if a Dalrad person was here, they would have been able to answer the question. As we are not the policy makers, we are delegated by the national director to implement what policies they make. So, and yes, it is true, there are not enough state veterinarians on the ground. As I said earlier, I only have 3 regulatory state vets in Gauteng. And then, during the outbreak, I had to pull in some other vets and myself to work on the ground. So yeah, that is the truth. We do not have enough state veterinarians. On the difference between vaccinating against H7 and Newcastle disease, there are various risks, and I'm not speaking as an expert in the field at the moment, but just we all know that H7 has the potential to be, it is a zoonotic avian influenza, We haven't picked the zoonosis up in, or transmission to humans up in South Africa thus far that we are aware of. But the moment you start to vaccinate, the issue becomes that we are also influencing the export markets, because not all countries are then willing to accept our products from South Africa the moment you start to vaccinate with H7 vaccine. So that is one of the major issues, and I am aware that most of the producers prefer to just supply the local market, but we also have producers who want to export. So that is one of the prohibiting factors at this stage. And I see that one of my colleagues has raised a hand, and so maybe he can take over from here.
Please go ahead.
Yeah, thank you. I'm the one who raised the hand. The question about vaccination and who can provide the supplementary supportive information to justify the quality assuring of the vaccination and the minimization of risks associated with the pathogen in question. Let me remind the audience, there is a reason why there is South African Veterinary Council that seeks to register people who are authorized to undertake animal health and animal production related exercises. There's a very good reason. It's because then you can hold those people liable for executing a prescribed disease control action properly or improperly. Immediately you allow lay people to then collect samples, for example. You may do that. The problem becomes, how do you interpret the results if they are negative? The layperson would not know what is randomization, for example. How do you give a valid scientific interpretation to a negative result? Because, yeah, if the results are positive, you would say, yeah, no, we found the stuff we are looking for in this population of animals. However, if the results are negative, they may be negative because a wrong sample was collected, and therefore you cannot make a disease control action based on that because it is not informed by a professionally collected sample in that instance. So I think, yes, I agree with Mr. Breitenbach to say, you know what, in order to control a very sneaky virus like this one, allowing lay people to then collect samples on the ground, yeah, it's a huge risk. In my analysis and epidemiologists to say you will not be able to make sense of whatever results come out of your monitoring, because they may or may not be useful.
Won't it be possible to, for instance, train people to do it properly and make them, you know, certified vaccination techs or something like that? Because to expect a veterinarian to be produced, I don't know, I know you've studied long and hard to become a veterinarian. We just don't have enough veterinarians in South Africa.
We have said to SAPO, not SAPO, SAPA, in our comments to the exemption and the vaccination guidelines, we had said, we are aware that there is probably thousands of unemployed animal health technicians who are registered South African Veterinary Council's paraprofessionals. You as the producers, you make up your own mind to engage them so that they do the monitoring and collections on your behalf, and we would then authorize them, because they would not be state employees, but we would authorize them to collect samples because they would have been registered with cancer. So the very people who you say, no, train the lay people and then authorize them, is the same thing. You train them, then you authorize them, and then it's just as the same as employing unemployed animal health technicians to do the job.
Well, of course, everyone is keen always to offload the cost of these measures on someone else. And I think one of the solutions that will have to be found will be who carries the cost for what, particularly when there's no culling compensation. And I know that's a Dalrad issue, and we will definitely follow up to organize a follow-up session. But I think this is a real conundrum for an industry already under enormous cost pressure with the collapse of infrastructure and other measures having been they have to deal with. We have a follow-up question, and that is Nick Wilson. I'm a reporter from News 24. And Dr. Kalaki, this is a question for you. I just want to point out, Nick, that Dr. Kalaki is not from Dalrad. He's from the Gauteng department. Nick's question is, he says, he was saying that there are still 19 outbreaks of H7 on the go in South Africa. Is that correct? Is this in Gauteng still, or any other provinces? And you said there were 10 producers affected by these outbreaks, not culling their chickens and seeking an exemption. I just want to clarify this. And so far, there have been 9.5 million birds culled. Is this before the 19 outbreaks on the go at the moment are taken into account, or does it take them into account as well? So is the outbreak which began last year still not under control? Would you like me to repeat these questions, Dr. Kalaki?
Yeah, no, let me try and answer. And of course, Dr. Grobler, being the manager supervisor on the ground, would correct me. Indeed, when the disease breaks out in the farm, in our terminology, we say we now have an open outbreak. We inform Dalrad so that they can inform the international community to say that there is one outbreak in South Africa in the province of Gauteng. When we remove the pathogen from that farm, clean and disinfect and satisfy ourselves that the risk has passed, we then close the outbreak. We inform Dalrad we have succeeded in executing the Animal Disease Act prescribed actions. We can vouch for the actions we took. They are the prescribed action, and therefore this outbreak that we reported to you can be considered now closed. Okay, so for Gauteng, as we said, we opened in the 23-24 outbreak, 80 outbreaks in Gauteng that we reported. Of those 80, okay, 19 are still open, which means 61 are now closed. There are all the activities, all the related actions that are required to control the outbreak have been executed successfully, and for all intents and purposes, those 61 properties are now free of H7. Of the 19 that we still classify as open, okay, those were people who were contemplating one way or the other whether or not they should apply for exemption and so on and so forth. Dr. Grobler, through his strong negotiation and conviction properties, of those 19, she convinced 9 that say, you know what, you guys, whilst we are waiting, remember you are under quarantine. It means you can't do anything with your base in that farm. Why don't you make the decision to cull? We'll help you to clean and disinfect and monitor so that at the end of 1 month post the last cleaning, which is the second cleaning and disinfection, you also join the 61 that would have been considered now closed outbreaks. So there are 9 that within a very short time, the 30 months waiting period would have passed after the second disinfection, and those will join the 61 so that we have 70 outbreaks closed of the 80 that were declared open. There are still 10. Those 10 have submitted applications to national to say, give us the approval so that we become exempted, so that quarantines are lifted. And of course, there are conditions, guidelines to anyone who wants to apply for exemptions to say, please give guarantees that the following you will be able to execute to the letter. And those are the things that perhaps are delaying the decisions in as far as these 10 exemptions are concerned. If you ask me, I would say bite the bullet and cull, because whilst you are not culling, waiting for an exemption decision, your farm is under quarantine, and in theory, all your eggs have been destroyed. All those bays, we don't know what you're going to do with them if you ever get back to allowing them to produce eggs for you, hopefully profitable. What is it? Productively. I hope I've answered the question. There are only 10 now outbreaks that are waiting for exemptions, but sooner or later, we'll probably have almost 70, because the 9 that I said that are still open, we're waiting to close them because they have culled, they have cleaned and disinfected twice, and therefore we are just waiting for the 30-day period to come to an end, and they will join the other closed outbreaks. Thank you.
Thank you, Dr. Kalaki. I'm going to ask a follow-up question from Michelle Gumedi. Is there a timeline for when the 19 outstanding outbreaks are expected to be dealt with? And a follow-up on that is, under what circumstances are exemptions granted? I don't know, Dr. Kalaki, if you want to address this one as well. So, timeline for the 19 outstanding outbreaks, when will they be dealt with, and under what circumstances are exemptions granted?
Those that are, the 9 that are still waiting, I think Dr. Grobler will correct me, I see her hand is up. I don't think within the next week or 2, they don't have finished their 30-day prescribed period after the second disinfection. I can't give the exact datelines, but I don't see mid-June coming and the 9 are still open, because for all intents and purposes, 30 days would have, I don't know when the 30-day time started, but 30 days would have passed. So these 9s would join the other 61. The other 10, I think, is a business decision they need to make, because DALRAD is considering the exemptions. If DALRAD considers the application exemptions and there is still outstanding information, the onus is on the applicant to fill the information gap. And when that happens, time passes. So the producers would have to make informed business decisions. If they ask me, I would advise them to come. But who am I? I'm just a veterinarian working for the state.
Dr. Kalaki, Nick Wilson follows up and says, so is the worst of the 2023-2024 outbreak over then?
Gee, even a futurist can't answer that, because tomorrow, which is perhaps something we need to flag to Mr. Breitenbach. A week or so ago, there was a rumor of some unconfirmed outbreak that was never reported to the state in Delmas. And just today, there is another rumor. And of course, you can't run a country through rumors. What you require is stakeholders to report, as required by law, their suspicions, so that investigations can be done and proper measures taken to confirm, remove outbreaks, and so on and so forth. I wish I would say the worst is over, but so far, other than these 2 rumors, which when you try and follow up the rumors, nobody can tell you which farm is being suspected of never having reported the outbreak. I would say, yes, it seems like we are moving in the right direction, save the 10 that have applied for exemptions, because the 10 have been confirmed infected with AI and are currently under quarantine. And in theory, therefore, the outbreak cannot be declared to have come to an end.
Thank you.
I hope I've answered the question.
Thank you, Dr. Kalaki. Karin Creer asks, regarding the guidelines for exemptions, so that's why I follow up with you, were these in place in full when the producers applied? And did the guidelines stay the same during these outbreaks?
Karin is firing questions. The guidelines stay the same until the population for which the guidelines were applied for, the population of bears has been removed. Presumably, after you have removed that population that triggered the application for the exemption, the farm will be cleaned and disinfected and therefore considered an avian influenza free farm. So the guidelines stay until the bears that were initially infected with AI have been removed one way or the other, either through culling or through other means.
But they stayed the same, is what you're saying?
Yes, they stay the
Okay.
same until the outbreak is closed. The farms that get exemption, it means the outbreak has not been closed because they still have bears that were either infected and or exposed to bears that were infected with AI.
Very well, thank you. Let me ask Mr. Breitenbach to just add some insights from his side on these points as well. Before we go to a question from Yvonne Nyembezi and Dr. Majukwene, I think you may be the best person to respond to her question. I'm going to give it to you in the meantime. What are strategies implemented to ensure chicken farmers in isolated rural areas receive adequate guidance on vaccination best practice, outbreak management, and access to relevant support networks and expertise? So maybe between you and Dr. Grobler, you can decide who should answer that. But first, let's hear Mr. Breitenbach on the points raised so far.
Francois, I think I want to reiterate that the stance of SAPA and it's expecting that from its members is to comply with the Animals Diseases Act. Secondly, in terms of the rumors that there were outbreaks, I certainly haven't heard these rumors and don't know about them. I think the question in my mind, for which I do not have the answer, is that if we talk about 10 flocks still out there, and they're probably commercial layer flocks since all the broiler breeder flocks died or were culled, are they still shedding virus? I'm not sure who will be able to assist us with this particular answer.
Well, that's a good question. So, Dr. Grobler, would you be able to respond to that?
Yes, thank you. I would like to respond to that. These farms are still under quarantine, and since the day that they have opted to not cull, we've been in a process of testing them constantly. There's a specific protocol which was designed by our Dallara team, and this is followed. So at this stage, we can definitely say that they are not shedding virus. And we are busy submitting all the body of evidence to DALRAD to get a partial lifting of the quarantines. These quarantines will not be lifted in full until the farms have been depopulated. And the only way how these farms will be able to depopulate is through slaughter or through culling. No spent hens are allowed to be sold off these farms. But we can definitely say with all the lab results that we have available and PCR testing that these farms are not shedding at the moment. Thank you.
Thank you very much. There's a follow-up question from Nick Wilson, which I just want us to clear, and then we'll go back to the question posed by Yvonne Nyembezi. Nick says, sorry to labor the point, but don't the Gauteng departments that Dr. Kalaki and Dr. Grobler and Dr. Majukwene Kalela work for as directors fall under DALRAD? Who would like to just clarify the reporting lines and so on?
Okay, let me let me put it as it is, okay? Provincialization, particularly when it relates to animal health related matters, the constitution, okay, makes it a matter of concurrent competency between DALRAD and national. However, provincial veterinary officials are not employees of DALRAD, they are employees of the provincial government. So I don't report to anyone at DALRAD, but because we are serving one unitary state, national and provinces have to cooperate because they have concurrent responsibilities for disease control to work together to bring disease outbreaks to control as soon as possible. So I report to my Chief Director of Veterinary Services in Gauteng. I don't report to Dr. Mudisani, but we engage daily or weekly with Dr. Mudisani on issues of livestock health in South Africa.
Thank you. That's a clear answer. Yes, indeed. Even I understood it. Thank you, Dr. Kalaki. Let's go back to the question that I raised earlier from Yvonne Nyembezi. What strategies are implemented to ensure chicken farmers in isolated rural areas receive adequate guidance on vaccination best practice, outbreak management, and access to relevant support networks and expertise? Dr. Majikweni.
Thank you so much, Francois. This is an easy one for me because it is not necessarily in my domain. The competence here really lies with DALRAT and probably with organizations such as SAPA as well. From our end, what we do, and particularly in Gauteng, what we have, and now I am giving a descriptor of a general system. What we have in terms of field workers is that we have field workers that are allocated across the province. Those field workers, they interact with farmers on a regular basis, wherein they provide assistance, they can provide veterinary services, they also provide support in terms of advice and so on. So where there are any issues that need any communication and information that needs to go through farmers across the province, we typically utilize the field workers that we have, your animal health technicians and the state veterinarians on the ground, as well as in some instances the extension officers and so on. So typically that would be the network. We also work through a system of having farmers' days, and those tend to be then information sessions where there are issues of this nature. However, one would say that is a system that probably needs supplementation, particularly from organizations such as SAPA, because SAPA is probably one of the biggest organizations in this part of the world. That is a poultry producer organization. And I do believe that it has a role in ensuring that whatever strategies or measures that they advocate for within the country, they need to ensure that they take along the entire industry with them. So it would be interesting to hear from Mr. Breitenbach what sort of measures they've put in place following them advocating for vaccination for the members, what they have put across to DALRAT in terms of those strategies as well to supplement what we already have on the ground. Thank you very much.
Very well. Well, we have 12 minutes left.
If I may add for the question from Metlengu, I think for what it's worth, I would advise her to know her extension officer and or know her animal health technician and or know her state veterinarian. Those people, wherever your farm is located, try and find out where these representatives from the state are, so that they're able to be the ones who can link you up with either disease control related actions or government producer support grant systems. That's how the entire setup is set up to be. So know your provincial agricultural extension officers or veterinarians or paraveterinarians, so that they're able to then capacitate you.
Very well, thank you. We're running out of time, and we have one last round of comments that I'd like to get to. Before that, Mr. Breitenbach, do you want to just add to what Dr. Majikweni said?
Francois, yes. I think it's a bit of passing the buck here, since we've got a government with agricultural extension officers that are employed to do exactly that. But having said that, if we look at what SAPA is doing already, we're in contact with 840 small farmers on a regular basis, where we give them advice, at least on a monthly basis, like, for example, warning them of outbreaks of influenza in certain areas. We have also trained in excess of 1,000 people, of which some were small farmers, some were veterinarians, some were people actually working with the small farmers to assist them to do exactly what the question was, and help them with vaccination, and so forth. And then we've also spent just more than a year in sending a group of people out to do biosecurity surveys for small farmers, and where they could end up having a action list of what they need to do to improve biosecurity and therefore their risk of contracting a disease like avian influenza.
Thank you, Mr. Breitenbach. I don't think people are always aware of everything that the big poultry farmers are doing for the health of the industry. We have 10 minutes left, and I want to ask each of you to respond as briefly as you can to the following question. What are the two most important lessons you've learned in your experience from this outbreak? What are the two most important things that would help deal with future outbreaks in a better way? So, two lessons learned, two actions to take. And let me start with Dr. Grobler.
Thank you. I think with an outbreak of this magnitude, I realized that cooperation between role players in the industry and not even just in the industry, I mean, the SPCAs, the national SPCA, is absolutely invaluable, as we do not have enough people on the ground. So something I realized was that the relationship between role players in the industry and the national NSPCA and the police is of utmost importance to be able to control a big outbreak like this. That was one of the lessons I felt was very important. And the other thing that we often hear is that diseases doesn't read textbooks. We all learn every day, and we can you cannot predict what's going to happen. And for that reason, we always have to be on high alert and have our action plans oiled at all times. I think that was the two most important things for me. Thank you.
And two actions? Or would you regard those as two actions?
Did I miss a second part of your question?
Well, I said lessons learned and the most important actions we can take to do better in future.
Actions to take in future. I think that we need to be proactive, as always, proactive in our relationship with other role players, and make sure that all systems are, that you have the connections, so that when something like this happens, that you exactly know who to contact and what to put in place. And that ties in with our emergency response plan, is to always be ready with our emergency response plan.
Thank you. Dr. Majekweni, I'm going to ask you to give us the two most important lessons learned and the two most important actions to be taken. But could you start out by just confirming for Nick Wilson? He says, these 10 open outbreaks that Dr. Kalake referred to, are they all in Gauteng? I'm sure all of you know the answers, so that's why I'm starting with you. Just confirm or correct that, and then two most important lessons learned, two most important actions to take.
Okay. Yes, indeed. It is 88 outbreaks in Gauteng, and then the 19, and then the 10 that are still open. Okay. I think for me, and by the way, I think this is something that I need to mention to Mr. Breitenbach. I wanted to give an opportunity for SAPA to also showcase the role that they play in terms of communicating with that sector, so that we can show how we actually tend to disseminate that information. And then the second aspect, the two things that I would like to see, I think better collaboration, not just communication, but collaboration between all of the stakeholders, all of the role players, when it comes to what the poultry industry needs to thrive, and to achieve all of its tenets. And having worked for the poultry industry, it is my understanding that they are looking to expand, and also from a transformation and an inclusion perspective as well. So I think we need better collaboration, and that collaboration needs to come with support services that are required for us to meet that future. When I say support services, we need to be able, from that collaboration, to look strategically at things like, what is the future research that we require, in order for it to enable the industry? What are the capacities that we need? For instance, when it comes to vaccination, we spoke about some of those things. So those are the things that I would like us to do better as stakeholders within this industry. And I think if we were to take hands and do that, we would really have a thriving industry that is able to enter various markets across the world and expand within South Africa, Southern Africa as well. Thank you very much.
Thank you. Dr. Kalake, in 2 minutes, can you tell us what the two most important lessons you have learned from this outbreak, and the two most important things that should be done now to do better in future?
Yes. Maybe let me frame my response to the two questions using this analogy, okay? Epidemics are similar to wildfires, okay? They become big if they are allowed to spread. So when an epidemic starts, when a disease like AI starts, speed is of the essence. The things that detract from speedy response are lack of cooperation, as my colleagues have said, are things like second guessing each other as to what could be going on, okay? When there is an outbreak, bring the fire extinguishers, bring the people to put out the fire, because if you don't, the fire spreads and becomes an even bigger thing. This outbreak reached 80 outbreaks because in the beginning, the application of the Animal Disease Act Table 2 regulations that apply to highly pathogenic avian influenza, there was reluctance in adopting them. We are very grateful for the other 70 who decided, indeed, the decision to cull is made, let's cull and stop this outbreak, because an outbreak, as I said, is like a fire. If you don't stamp it out, it spreads. It will burn your house, it will burn the neighbor's house, it will burn the entire neighborhood.
Thank you, Dr. Kalake.
Yes.
Thank you very much. Let me ask Izaak, in 2 minutes, can you answer the same two questions, the two most important lessons learned and the two most important things to do for the future?
Francois, thank you. I've certainly learned a lot of lessons, and it was a valuable discussion for me, being part of the problem. And I think that if we talk about avian influenza, it is not Gauteng Department of Agriculture or National Department of Agriculture's problem. It is our problem, including SAPA and the producers. And if you ask me what I would like to see, I think that what we've seen happening is that we took actions that precipitated the wrong action from producers. And we need to try and minimize that in future. I think compensation is sitting there as a big issue. If we were compensating, I don't think we would have had the discussion at all today. Secondly, the farms that are not shedding, as it was said earlier by Dr. Grobler, I think we need to get them approved and get the problem out of the way. And then secondly, in terms of vaccination, a similar thing. If we have protocols that are so onerous that we can't comply with them, then we as a group have not done our job to curtail the virus that can jump into other species and can jump into humans. And with that, I've got great respect for Dr. Marja and her team. She has certainly been lenient to us. She has compromised a lot during our negotiations on these protocols. But still, I think that if we look at the protocols that we do have, they are of such a nature that I'm concerned that we will enhance or motivate producers to not behave in a way that we would like them to behave, and that is the Animal Diseases Act.
Thank you, Mr. Breitenbach. Well, this brings to a conclusion our discussion today. We have run out of time, and I want to be very respectful of everybody's time. Craig McCaskill asked whether there will be a press release. Craig, there will be a summary of the discussions once everything has been properly transcribed and so on. So it won't be today. It'll probably be in the next day or so. From the side of FairPlay, I want to commend everyone, not only for giving up their time, but particularly sharing the expertise, being willing to be open, and not only open in terms of sharing information, but also open in listening to others with different viewpoints, and coming, I think, to a very useful conclusion in this session. To the media who joined us, I hope this was really useful to you. It certainly was very useful to me in learning about this. And I think there's also a very important role to be played by the media in ensuring that the facts and the opinions are properly communicated. And I know the people on this call will all be doing that. So thank you very much for your support. Without you, there's no point in having this conversation. And I'm grateful to everyone who joined us. Thank you very much, and goodbye.